Good evening, everyone. So today we are going to discuss postpartum hemorrhage. The reason why I'm keen to discuss this particular topic is because there are people who are close to me that I know whose wives have passed on while giving birth. And the other reason that made me even to decide to even discuss this particular topic is because women of reproductive age are also affected by postpartum hemorrhage. That also includes adolescents and youth. So what necessarily is postpartum hemorrhage? It is severe bleeding after giving birth. Okay, so you find a woman has gone to the hospital and then maybe she has done a CS or she's given birth naturally, and you find that even after giving birth she bleeds too much and she passes on. So according to data even from the Gates Foundation and even from a conference that was recently held in Cape Town, South Africa, on maternal health. So you find that data reveals that 70 women are dying from this preventable and treatable condition each year. That is one death every 6 minutes. Okay? And that captures only a fraction of this truly unacceptable problem. So you find that some 287,000 mothers die each year during pregnancy or childbirth. That's one death every 2 minutes. Imagine one death every 2 minutes because of this. And imagine, even as a woman, you've carried your baby in your womb for 9 months, and then this happens, and you find that even the mother dies. This is not. This is terrible. And of course, a mother's health is extremely tied to the health of her baby. So 1.9 million babies are stillborn each year. Another 2.3 million newborns die in their first month of life. So when mothers and infants die, mourning and traumatized families and friends are left behind. Communities and even economies suffer. But you know what? Many of these deaths are preventable. So this particular situation, postpartum hemorrhage, currently affects around 14 million women each year. That is globally. But a new protocol described in a recently published study led by the World Health Organization and the University of Birmingham may drastically help reduce that particular number. So according to the Gates Foundation, the study shows that having access to an immediate bundle of care called e-motive, which includes a low-cost drip that can measure blood loss, can help medical workers take timely and appropriate action to save lives. So at least we can now see that there is a new development, there is innovation currently taking place to curb this increase. And you also find that a company called Philips, you all know it, has developed portable ultrasound probes that are so compact and they can fit in a pocket. So These new devices can be connected to smartphones or tablets to produce images that can help clinicians identify warning signs early in a pregnancy. So postpartum hemorrhage is a serious condition, and it is paramount that that even women get to identify them. So you find that even there are two types of postpartum hemorrhage. So there is primary postpartum hemorrhage, which occurs within the first 24 hours after delivery. And there is secondary or late postpartum hemorrhage, which occurs 24 hours to 12 weeks postpartum. Okay? So I know you're asking yourself, why does this postpartum hemorrhage occur? So there are a few reasons why postpartum hemorrhage occurs. So your placenta attaches to the wall of your uterus and provides food and oxygen to your baby during pregnancy. After your baby is delivered, your uterus continues to contract to deliver the placenta. This is called the third stage of labor. Contractions also help to compress the blood vessels where the placenta was attached to your uterine wall. Sometimes these contractions aren't strong enough to stop the bleeding, called uterine atonion. This is the cause of up to 80% of postpartum hemorrhage. And it can also happen if parts of the placenta stay attached to your uterine wall, or if parts of your reproductive organs are damaged during delivery. You are at a risk of postpartum hemorrhage if you have a blood clotting disorder or certain health condition. So I know you might also ask yourself, who does it affect? So it can affect anyone after childbirth. There are many risk factors for postpartum hemorrhage, but approximately 40% of hemorrhages occur in women without any risk factors. Most postpartum hemorrhage occurs right after the placenta is delivered, and postpartum hemorrhage may be more likely after C-section. So, how serious is postpartum hemorrhage? So, postpartum hemorrhage is a serious and potentially fatal condition. With postpartum hemorrhage, you can lose large amounts of blood very quickly. Blood pressure, which can restrict blood flow to your brain and other organs. This is called shock, and it can lead to death. Postpartum hemorrhage is a medical emergency and needs to be treated right away. So how will you know if you are experiencing hemorrhaging postpartum? So the most common symptoms of postpartum hemorrhage is persistent excessive bleeding after delivery. Other signs of postpartum hemorrhage are symptoms of a drop in blood pressure, like dizziness, blurred vision, or feeling faint. The other one is increased heart rate, decreased red blood cell count, pale or clammy skin, nausea or vomiting, worsening of abdominal or pelvic pain. So how is it diagnosed? So healthcare providers diagnose postpartum hemorrhage through visual and physical examination, such as lab tests and a thorough review of your health history. They may detect postpartum hemorrhage based on the amount of blood you've lost. Measuring the volume of collected blood and weighing the blood-soaked pads or sponges from delivery is one common way to approximate blood loss. And we can see now that that even that's also the reason why you can find that innovations have been developed to curb them. Even as I mentioned earlier, there's the e-motive. One is called e-motive, and the other one is also an innovation by Philips. So how do doctors treat postpartum hemorrhage? Healthcare providers treat postpartum hemorrhage as an emergency in most cases, stopping the source of the bleeding as fast as possible and replacing blood volumes are the goals of treating postpartum hemorrhage. Some of the treatments used are uterine massage to help the muscles of your uterine contract, medication to stimulate contractions, and removing retained placenta tissue from your uterus, repairing vaginal, cervical, and uterine tears, packaging your uterus with a sterile gaze or trying off the blood vessels. So there you have it. So it is good to be informed about this particular condition. And even recently, you've even found that even at Mama Lucy Hospital, that is situated in Nairobi County, here in Kenya, a woman died because of this postpartum hemorrhage. And we find that this particular case is also being recorded in other counties in Kenya as well. And the other thing is, yes, we can see that the government is doing its best to ensure that we curb this particular trend, because even the death of one person is one too many. Nobody should die. Nobody should die because of childbirth. Every life is important, and that is why it is important that there is need to increase investment towards even health, and more so even looking at even reproductive, maternal, newborn, child, adolescent health. There is need even for you, even who's watching, to become an advocate and even be presenting to policymakers or government why they should prioritize their funding towards health, more so reproductive, maternal, newborn health, so that, you know, once the government allocates funding even to purchase this equipment, that even can go and reach rural areas, we will find that the trend even here in Kenya is gonna reduce, because at the moment in Kenya, data reveals it's at 9% of the number of persons who die because of the postpartum hemorrhage. So thank you for joining us, and I hope you've learned something about this particular subject. And even the source of my data is from Cleveland Clinic, as well as Gates Foundation, who are playing a key role in curbing maternal deaths. So thank you for watching, and enjoy your evening.